All right, guys, Dr. Scott Sanders at BalanceMD is here, and he brought his team with him. Good to have all of you this morning. I think when we're talking about dizziness, for some people, initially they might think, oh, it's because I got up too quick, or maybe I had too much to drink, but there is a medical condition, and you guys at BalanceMD handle it from a multitude of directions. So why don't you introduce your team first, and we'll kind of get started.
Great, yeah, thank you. First of all, it's been shown that the vestibular disorders, dizziness, vertigo, are best handled by a team working together. So Michelle Coley is our audiologist at our Indianapolis office. Sandy Bratton is audiologist at our Lafayette office. And Stephanie Ford is our physical therapist who goes to both offices.
All right. And so with this team today, we're going to get to hear from each individual and sort of what they do so that it's more clear when you do go into their office and they send you to a particular expert. You know what kind of assistance you're getting. So where do we want to start today, doctor?
Well, we start when a patient comes into our office. I see the patients initially, and we always screen for a condition called BPPV.
Okay.
This is known as, many people know it as a crystal problem, where you have vertigo when you lay down or sit up or roll over in bed. And we have a cartoon that shows this condition. Okay,
let's take a look at the cartoon there. If they will let you know, and that's one thing, that's something that certainly experienced myself as well. And maybe we don't have that. Oh, okay, now it looks like now we're seeing, this is the maneuver. Who's handling this?
This is, Michelle's going to tell us about the Epley maneuver that's the cure for BPPV.
So yes, this maneuver is done. It's very brief, as you see, where we lay the patient back and we're actually moving the crystals around the semicircular canals in the inner ear and putting them back where they need to be so that they no longer cause us any trouble. The crystals in the ear are actually there to detect gravity for us, so they kind of help tell us what end is up and all that, and as long as they stay where they're supposed to be, they don't give us any trouble at all. But when they get lost in other parts of the ear, the simple rolling procedure that you just saw helps put them back and cures your dizziness.
And what's cool about it too is it looked absolutely painless.
Yes.
I mean, it's just quick and okay, fabulous. Now, will she feel relief, the person in this, immediately, or does it take a couple minutes for it to sort of
typically right away.
Okay.
Typically right away.
Great. Okay, good. All right, there's possibly one easy solution. What's next?
So patients who don't have this condition will often come back to have what we call vestibular function testing, which is a series of tests that look at inner ear function. And the way we look at inner ear function is through eye movements. And we have a video of our rotary chair that we have in both of our offices that Dr. Bratton is going to tell us about.
So the rotary chair helps us look at what we call the VOR, the vestibular ocular reflex. And what that does is it allows us to keep things in focus when we turn our heads. So our eyes follow in a certain pattern anytime our head is moved. And looking at that pattern, it's a very predictable pattern across everyone. And so by looking at that pattern, we can tell if the inner ear told the brain the right information about where we're going and how quickly we're getting there.
Oh my goodness, that's okay. And how long does this test take about?
Start to finish, if we go right through, maybe somewhere between 8 to 10 minutes.
Okay. All right, and again, looks very painless.
Very painless.
Which is what we like, keeping with that theme. See there? Okay. And then after we've reached a possible diagnosis, what's the next step?
The next step is either medication or see Stephanie Ford, the physical therapist, who specializes in what we call vestibular rehab, of which there are unfortunately very few physical therapists who are adequately trained in this area.
So you kind of got the market cornered there.
Yes.
A little bit. I was able to go to further education after physical therapy school, which when I went to physical therapy school especially, there wasn't as much information known about this. So most of the research for treatment and effectiveness of treatment and research has come through the last 20 to 25 years. So I've been able to go to certain courses which with the experts in the field. You have a competency exam that you take at the end of the course to make sure that you know what you're doing with those. So with the diagnosis that we can get from the vestibular function testing, that helps me direct my treatment better. I know what I'm treating. I can be more efficient and more effective for the people that we're treating.